Today, I'm going to demonstrate the longitudinal dissection of a mammalian heart at grade 11 level. In this dissection, I'm going to use a cow's heart as my specimen that I obtained from a local butchery. Just a rundown of the materials that I'm going to be using in my dissection. This is my first specimen, the cow's heart. This is my 9-piece dissection set. My household cleaner, anti-anti, and paper towels that I'm going to use to wipe the surfaces post-dissection. And this is my first aid kit that will come in handy as I'll be working with sharp objects in case of any accidents. I'm wearing latex gloves to protect my hands from any contamination and my laboratory coats to protect also my clothes from any contamination. Now to begin my dissection, I'm just going to hold my specimen in my hand and I'm going to use my dissecting needle to show the 4 chambers of the heart that are seen from the anterior surface of my specimen. From the right side, this is the right atrium, this is the right ventricle, left atrium, and left ventricle. The left side of my specimen has got thicker cardiac muscle than the right side, hence it looks a bit bigger. Why? Because the left side of the heart is responsible for carrying oxygenated blood under a lot of pressure, and the right side carries deoxygenated blood at low pressure. Now to begin my dissection, I'm going to use my dissecting scissors and I'm going to cut through my superior vena cava into the right atrium of the heart. Okay, and into the right ventricle. I'm just going to deepen my incision with a scalpel blade. Okay, let me cut it further, deeper. Okay, there we go, until the apex of the heart. Okay, right. I'm going to use my dissecting needle to point out all the internal features. So from the right atrium, blood enters the right ventricle, and the flow of blood is kept one way by a set of valves that we call the semilunar valves. These semilunar valves are held by tendinous cords that are called chordae tendineae. As you can see, these are chordae tendineae. These chordae tendineae are attached to cusps. These are the cusps that hold in place the semilunar valves and prevent any backward flow of blood. Now, when the blood is inside the right ventricle, it flows up into the pulmonary artery. Let me just put my finger inside. There we go. En route to the lungs to receive oxygen. We have another set of valves which we call the semilunar valves that prevent the backward flow of blood back into the right ventricle. I'm going to cut through the right side of my heart. As blood flows from the lungs, it enters the heart through the pulmonary vein. The pulmonary vein is not clearly visible, but I'm going to try and zoom it closer. There is the pulmonary vein. So as you can see, veins have got thinner walls than arteries. So I'm going to cut through the pulmonary vein into the left atrium and into the left ventricle of the heart. There we go. Okay, as blood enters the left atrium, it is emptied into the left ventricle, And there is another set of valves, which we call the bicuspid valves, that prevent backward flow of blood. Again, they are held in place by chordae tendineae. Then the blood flows into the left ventricle. As you can see, there's a thicker cardiac muscle on the left side of the heart. From there, the blood flows into the main artery, which is the aorta. Let me just put my finger. The aorta is the main artery that transports oxygenated blood to the rest of the body. There is another set of valves, which we call aortic semilunar valves, that prevent the backward flow of the blood back into the left ventricle. Now I've successfully dissected my cow's heart, and just take note that I was using my kitchen tray in place of a dissection tray as an improvisation method to be able to contain my specimen. Post-dissection, I'm going to dispose of the specimen in the proper manner, and I'm going to clean up my surfaces with handy and wash my hands as well to avoid contamination. Thank you so much for